All right, so we are on slide 17, and we have dual innervation. So I had mentioned this before, but we need I'll give you some examples. Some examples of antagonistic effects. And again, this is the norm, but not always the case. We always have these exceptions. So it ends up that heart rate can be increased by sympathetic division outputs. So when you're at the gym, you don't want your heart to slow down. You want it to go faster, right? Because you're shaking and moving, right? And so sympathetic divisions will increase outputs, will increase your heart rate and stroke volume, the amount of blood that is being pumped. Now, also, though, to keep it from going through the roof, right, we have parasympathetic divisions that are putting the brakes on. And so you're driving with one foot on the accelerator, one foot on the brake, and you control your heart rate in that manner. So that's a classic example of how the sympathetic division outputs will increase heart rate and and the parasympathetic division will decrease the heart rate. Now, an example of an exception to or a flip-flop of who is stimulating and who is inhibitory, excitatory and inhibitory, when we talk about digestion, parasympathetic divisions are excitatory for digestion, whereas sympathetic divisions are inhibitory. Used to be, when I was growing up, early on in the days of drug abuse, they would always say, you could tell if somebody was on drugs how. Why, their eyes would be so dilated, I know they were on drugs. You'd hear that kind of thing. You don't really hear that much anymore. I don't think physiology has changed, but anyway, it was one of the early things that people always talked about. Well, it ends up sympathetic division outputs cause your pupil to dilate, to become larger, and parasympathetic outputs make it smaller. And so the drugs of abuse, I'm sure it was something like an amphetamine, sort of like, speed, those kind of things dilate your eyes. All right, so we said we have dual innervation, but it is not always antagonistic. Sometimes it's cooperative. And so it ends up that sympathetic division outputs increase salivary secretions, and parasympathetic division outputs also increase salivary secretions. They cooperate to produce the liquid in your mouth. So you have different salivary glands, and some of them are stimulated. Parasympathetic division is secreting the more liquid type saliva, the serous saliva, and the sympathetic division is making that more mucousy kind of saliva. All right, well, it ends up. So we said we have antagonistic dual innervation, cooperative dual innervation, and then you have without dual innervation. So it ends up some physiologies are only under the control of the sympathetic division. And so with that, we can talk about something called sympathetic tone. And so if you have more sympathetic output, you have more of an effect, or if you reduce the sympathetic output, you have less of the effect. But you don't have the parasympathetic division putting on the brakes. Things like the erector pili muscles, remember those from A&P1? Those make your hair stand on end. Sweat glands can be this way as well, and some blood vessels are controlled in this way. So to constrict the blood vessels more, you increase the rate of sympathetic outputs, and to decrease them, you decrease the rate of sympathetic outputs. All right, so we have a summary slide here, slide number 20. We have some generalizations. This slide right here, so we can see that the heart basically is excited by sympathetic division and inhibited by the parasympathetic division. In most cases, blood vessels are only under the control of the sympathetic division, so we have that sympathetic tone thing. The lungs, sympathetic division and parasympathetic division, they're both involved there, but we have some contradictory stuff going on with regards to in the lungs, the sympathetic division causes the dilation of the bronchioles. So that's why you don't want to block sympathetic division when you're talking about asthma. And the parasympathetic division is going to be constricting it. Digestive tract, we already mentioned that the parasympathetic division is going to be stimulating it, and the sympathetic division is going to be reducing it. I've talked about people who in nursing homes, when a patient is having trouble going to the bathroom and they're straining. So we said, what happens with the parasympathetic division? If you're straining, what you're doing is you're increasing the parasympathetic division outputs when you're trying to go to the bathroom, and people can pass out. I've had people who work as CNAs say they have to be careful and watch the patients when they're really struggling to go poop, because they will have an effect on their physiology where they pass out because the parasympathetic division outputs overcome the sympathetic division outputs. So that's sort of where we have that. Urination. Sympathetic division is going to relax the sphincter, relax the muscles around the bladder. Parasympathetic division is going to constrict it, causing you to pee, move urine out of the bladder. We already talked about the eyes with the sympathetic division dilating the eyes, parasympathetic constricting it. Then we have in some sweat glands are stimulated by sympathetic division and inhibited by parasympathetic division. All right, so we have all these drugs where we're trying to modify this kind of physiology. And so we have mimetics and lytics. So when we say a sympathomimetic, what we're saying is we're going to be pushing that. That's a drug that is going to increase one or the other division. So we can say a sympathomimetic would be to stimulate sympathetic division outputs. And a sympatholytic has the other effect, inhibiting it. And again, we can have parasympathomimetics and parasympatholytics. Okay, so the final slide on all of this has to do with the control of physiology. And if you remember, we had talked about, the fight or flight or reproductive kind of stuff or anger. All of this kind of stuff is controlled by the limbic system and the hypothalamus. And then we had said that we have the other parts of the brain, the reticular formation, which we had said is going to be controlling all kinds of basic physiologies. Well, all of this stuff is going to be involved in controlling the autonomic nervous system outputs. So we have all of these different portions of the brain that are playing a role in determining what kind of outputs are being sent out. And then in some cases, it's even voluntary. So we have the frontal lobe. So especially when we talk about peeing, urination, something called micturition, actually. It's urinating. But it's a little bit under the autonomic nervous system. That controls when you get the urge to go to the bathroom. But voluntary, you don't just pee whenever that happens. You run to the bathroom, right? And so the frontal lobe, which controls voluntary motor function, it's also going to play a role. And then even the spinal cord, we'll talk about how once you get something going, again, we seem to be talking a lot about peeing and pooping right now, but once you start to pee, it happens on its own because there's a micturition reflex that causes you to empty your bladder once you start the process. So again, with the autonomic nervous system is a fickle animal. It's very complicated and very, very hard to come up with generalizations, but it's super duper important. So we need to understand it. Okay, kiddos. I'll get this up and we'll be more or less caught up. We'll be doing eyes and ears and all that stuff we call special senses next time. Next time I'm talking to you on the small screen. All right, kiddos. Talk to you later.